So let's start. Let's start with this. Guess the word. The clue for the word is I am used to describe the current status of temporomandibular disorders. I'm sure most of you would have tracked out this term. It's a normal English term. Dilemma. What is so much dilemma in temporomandibular disorders? You all know everything in temporomandibular disorders or TMDs is a dilemma. Be it etiology, what causes TMD? There are multiple possibilities for etiology. What is the diagnosis for TMD? How do you diagnose a TMD? Do you have a proper diagnostic tool for TMD? What is the impact of the treatment on TMD? So you have given a treatment to a patient, and what is the impact of the treatment on the signs and symptoms of on the patient? So yes, these all have answers. There are existing tools, there are different ways of measuring it, but all tools or diagnostic tools or the measurements or impact measurements are a data that you get from the patient. The patient tells you, my pain is reduced, and you are forced to believe it. So with this dilemma background in mind, let us move on to today's topic of mine, Unearthing the Holy Grail, Biomarkers in TMD. So I will be discussing on the introduction. What is it? What are biomarkers? Why do we need a biomarker for TMD? The state of science of biomarkers, the present status, and the future perspectives of biomarker science on TMDs. So moving on to the introduction. Biomarker refers to a characteristic that is objectively measured and evaluated as an indicator of normal biological process, pathogenic process, or pharmacological responses to a therapeutic intervention. So it is a molecule, it is a biological molecule which is present normally in a body, and the measurement of that molecule increases or decreases during a pathogenic process. So it is present during the disease also. And when you treat the disease, the abnormal values have to come down to normal. So that is pharmacological. It should show some pharmacological responses, some variation to pharmacological responses. So common examples of biomarkers include blood pressure. Blood pressure is a biomarker for risk of stroke. Body temperature is a biomarker for fever. So moving on, what are these molecules? They can be cells, proteins, metabolites, carbohydrates, imaging, RNA, DNA, etc. So based on what they have been classified to molecular, radiographic, histologic, and physiological. So molecular includes normal biophysical properties which allow their measurements in biological samples like blood, serum, or CSF. Example is the blood glucose level that we usually check routinely. Second type is a radiographic measurement or a radiographic biomarker, which is obtained from imaging studies. For example, BMD or the bone mineral density. The next you have the histologic part or the histologic biomarkers, which reflect biochemical or molecular alteration in cells, tissues, or fluids. So they are used for grading and staging of cancers. So physiologic is just like we saw the temperature, blood pressure, it measures the body processes. So what are the critical features of a biomarker? First one is required presence in all diagnosed patients with high sensitivity. For example, if you have a disease which can be graded as grade 1, 2, and 3, it's present. The biomarker of that disease has to be present in all the 3 grades. It is not enough. It is present in just the 3rd grade. That is, it has to be very sensitive to minor gradation in disease progress. Second one is it has to be detected before obvious clinical symptoms are present. That is the predictability. That is, the disease might happen in the future, but the biomarker should predict the presence of disease or the occurrence of disease in the future. Practicality and ethicality. Ethicality, that is understood. Practicality you can explain using the two words, that is the speed and the cost. It should be affordable. At the same time, it should give you results immediately. Fourth one is the reversibility after proper treatment. That is, if you have a disease, you find out an abnormal level of biomarker, you give a pharmacotherapy for that patient, then the biomarker should come down to or reverse to the normal values. So the fourth point that we discussed is the most important point or concept in case of development of drugs or in pharmacotherapy. So what are the five phases of research process in case of biomarkers? First one is define the clinical question, samples, and workflow. In that step, you make a list of all the existing biomarkers. Might be it's like you have a doubt about a biomarker, but all such biomarkers are listed in the workflow. Next one is detect the multiple biomarker candidates. What are biomarker candidates? Those biomarkers which show a group dependent variation or a time dependent variation. For example, the biomarker levels are different in different groups of diseases or different grades of the same disease, or with the time dependent means with the severity of the disease, the biomarker levels are varying. That means that biomarker has something to tell you. So those biomarkers, time dependent and group dependent, are labeled as biomarker candidates. So these biomarker candidates move to the validation process, and finally, in the validation process, the most sensitive specific biomarkers are identified and identify, measure the biomarker, and that then becomes the proper labeled final biomarker. So that is biomarker in general. Why do we need a biomarker for TMD? That is, you have something like a concept of clinical outcome assessment versus biomarkers. Clinical outcome assessment is what is I told in the first slide. That is, everything in TMD is patient dependent. For example, DC-TMD criteria or the diagnostic criteria for TMD that is used worldwide decides on treatment, decides on diagnosis and management based on what the patient tells you, based on patient feelings, patient's function, and patient survival. So that is why this affects the randomized controlled trials or studies which are done on TMD. The data that is retrieved from these trials are not valuable because they are not quantitative. They are qualitative analysis based on patients' remarks. But biomarkers, in that case, they are very objective, they are quantifiable, they give you a number or a quantity in which it is present, or it can be reproducible. At the first stage before disease, you take the biomarker, you can see higher levels of biomarker. For example, it can be lower also. In case it is higher, you give a treatment and you repeat the test. So that reproducibility is ensured when it is a biomarker. But in case of a patient, it depends on patient's mood, stress, and psychological status. So biomarkers with the three basic things, that is the factors, or that is objective, quantifiable, and reproducible, makes them completely fit for developing data for trials. Trials is not just doing trials for research. Trials and best done trials are needed for patient care, clinical research, as well as pharmacotherapy. So to make these studies valuable and to make this data derived from quantifiable inputs, we will have to depend on the biomarkers. So we can slowly wipe out this dilemma from TMD. So what are the samples that you can get for screening biomarkers in TMD? The best representative sample is the synovial fluid. Then comes the blood, which means blood plasma or blood serum. It sometimes blood comes before, or blood has more priority than the synovial fluid when there is a systemic joint disorder that is affecting the TMG. So there, blood can also be considered. Then research has been done on saliva and urine as well. So what is the state of biomarker science of TMDs? Where are we in biomarker science of TMDs? Do we have at least a few names to tell? Of course, yes. There are a lot of studies which has done, in which they have analyzed different biomarkers. You can see these are the latest ones. They have used a diagnostic criteria or a questionnaire, which is again a qualitative one. And the third column tells you which are the samples used, and the fourth tells you the names of different biomarkers marked out of them. So diagnostic criteria has been used, different techniques of arthroscopy, imaging, all that has been used. And the most commonly used sample is the synovial fluid. And the potential diagnostic markers include IL-1, 6, 8, 10, TNF alpha, and all that. Among this, the most commonly used biomarkers are the cytokines. What are these cytokines? Cytokines are of two types, that is pro-inflammatory cytokines and anti-inflammatory mediators. The pro-inflammatory cytokines are they have been researched to have more inputs in causing osteoarthritis and internal derangement. The pro-inflammatory cytokines include the interleukin 1, 6, 8, and TNF alpha. So the mechanism of action is the pro-inflammatory cytokines produce proteinases. That is, they are enzymes which result in bone cartilage breakdown. So that is why there is an arthritic issue or a derangement happening. So compared to pro-inflammatory cytokines, anti-inflammatory mediators have contributed less. They contribute less, but they are still contributing to TMDs. So there is a different group or a differently group of biomarkers which have been proposed to cause myofascial pain. For example, the salivary cortisol. That is, TMD patients are likely to present higher salivary cortisol levels as a response to stress of TMD pain. That is, cortisol is a hydrocortisone, which is, to be more specific, glucocorticoid. So it is released by our adrenal cortex. So whenever you are under stress, this increases. So in TMD, it has been researched, or it has been found out that salivary cortisol increases during such cases. So total antioxidant capacity. So we want antioxidants to be present because it is good for our body. But in case of stress, there is more release of free radicals. It is not free radicals act against antioxidants. So there is more release of free radicals. So again, the free radicals are released in stress. So what happens in case of TMD? The total antioxidant capacity comes down. So the third biomarker proposed for myofascial pain is dopamine. Dopamine levels were higher in patients with myofascial pain, that is MTMD, according to a study done by Dawson. So where are we? What is the state of science of TMD? Science of biomarkers on TMD. No rigorously validated biomarkers. To establish a biomarker, rigorous research has to be done. Next is, it is very unlikely to have a single biomarker pointing to TMD. So you can actually predict, you can predict that you'll have a series or a panel of biomarkers which can indicate a TMD. As of now, no confirmed biomarkers. A number of inflammatory markers have been proposed, and among that, suggested potential biomarkers have been given. So those suggested ones we saw earlier. So what are the future perspective of biomarker science of TMD? Once are we going to find out a proper biomarker? Or if we find out a biomarker, what next? Next, researchers are predicting the omics study of TMDs. That is, once you predict the biomarker of a disorder, you are actually finding out the genetic family of that marker. So then you move on to genetic studies of TMD. So genetics is broad, but biomarker points out to which group of genes that you have to focus for genetic studies. That is omics. What is omics? It is the study of biological molecules. Genomics is the study of genes. Proteomics is the study of proteins. And transcriptomics is the study of DNA, RNA. And metabolomics is a study of metabolics. So metabolites. So omics is the future. So once we establish biomarker, then we will have to move on. So what is the concept of this omics? According to omics concept, we all are biological molecules. We all are proteins, chromosomes, DNA, etc., etc. So what happens is, if all these biological molecules are arranged in a structured way to form cells, organs, and then us, finally us. So finally we function, we have dynamics and all that. So anything that we have, who is responsible? The basic biological molecules are responsible. The genes, the chromosome, DNA, RNA are responsible. So now omics studies is tracking a disease to the genetic level or the basic biological cellular level of that structure. So that is the future of omics. Means future of TMDs. Already genetic studies are going on. They have tracked genetic coding, decoding, etc. in TMDs. So it's a 15 minutes presentation on biomarkers. So someday in the future, somebody would stand and ask you to guess this word. And I hope the clue would be the Holy Grail has been unearthed. So we hope to find a biomarker so soon. So thank you so much. Thank you for the opportunity. I present all my thanks to the department, my second home. Thank you. Thank you.
Okay, thank you, Dr. Saranya. Okay, I have a few questions. How you identify these biomarkers?
The biomarkers, as I told, we have to find out the sample.
Yeah.
For example, I can explain with an example.
Okay.
For example, if you are focusing on dopamine.
Okay.
If you are to look for a quantitative analysis of dopamine in some sample, for example, blood, you have to, maybe the study design would be control patients with TMD patients. You have to draw the blood. You will have to look for the characteristic or the separation of dopamine from blood. Different metabolites will have different way of separating them. From blood, now we will have to separate the dopamine. So that will have a protocol. Basically, you mix with some amount of NaOH or hydrochloride solution. You will have to centrifuge it, and based on this much time, this much temperature, and finally you will get dopamine separated. So based on that, you will have to go for the analysis. Analysis is like, it can be an ELISA test, it can be an HPLC, high profile liquid chromatography. So based on that, the samples have to be run through these, and finally the readings be obtained. So different molecules will have different protocol for that.
Okay. 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 Thank you, Saranya.